In this video, we'll be discussing an essential medication often encountered in nursing practice, which is budesonide. This medication is commonly used but can have significant effects on the body, requiring careful nursing considerations. Let's dive into its indications, action, adverse reactions, contraindications, nursing responsibilities, and patient education. Vital Nursing 101, your ultimate guide to nursing success. Starting with indications, budesonide is indicated for several conditions including asthma, chronic obstructive pulmonary disease, allergic rhinitis, inflammatory bowel disease, and off-label uses. Let's learn about each indication now. Asthma, used as a maintenance therapy to prevent asthma exacerbations. Chronic obstructive pulmonary disease, often combined with bronchodilators for better symptom control. Allergic rhinitis, reduces nasal inflammation caused by allergies. Inflammatory bowel disease, specifically effective for mild to moderate Crohn's disease affecting the ileum and colon. Off-label uses, occasionally prescribed for autoimmune or inflammatory conditions based on clinician judgment. Understanding these indications helps you identify why your patient is prescribed budesonide. Alright, moving along, let's now learn about the action of budesonide and how it works. Budesonide works by inhibiting inflammatory responses, suppressing immune activity, and improving airway function or intestinal lining repair. Inhibiting inflammatory responses. It reduces the production of pro-inflammatory cytokines and mediators. Suppressing immune activity. Decreases the activity of immune cells like macrophages and eosinophils. Improving airway function or intestinal lining repair. Its localized anti-inflammatory effects contribute to symptom relief in respiratory and gastrointestinal conditions. This localized effect minimizes systemic absorption, reducing the risk of widespread corticosteroid side effects. Adverse reactions. While budesonide is generally well tolerated, adverse reactions can occur, including these common side effects, which are oral thrush, hoarseness or cough, nasal irritation, mild gastrointestinal discomfort, and serious adverse reactions are hypercorticism or adrenal suppression with long-term use, osteoporosis or bone loss in chronic use, growth suppression in pediatric patients. Monitoring for these effects and educating patients about proper administration can help mitigate risks. Contraindications. Budesonide is contraindicated in patients who have a known hypersensitivity to the drug or its components, are experiencing an acute asthma or COPD exacerbation requiring immediate bronchodilation, have untreated systemic infections, including fungal, bacterial, or viral infections. Being aware of these contraindications ensures patient safety during therapy. Nursing considerations. As nurses, you play a vital role in administering budesonide and monitoring its effects. Key considerations include proper administration, monitor for infections, growth monitoring, assess symptom relief and drug interactions. Proper administration. For inhaled formulations, ensure the patient uses a spacer to reduce the risk of oral thrush and instruct them to rinse their mouth after each use. Monitor for infections. Assess for signs of local or systemic infections, especially in immunocompromised patients. Growth monitoring. Regularly check growth parameters in pediatric patients on long-term therapy. Assess symptom relief. Evaluate the effectiveness of the medication in controlling asthma, COPD, or IBD symptoms. Drug interactions. Be cautious with concurrent use of CYP3, A4 inhibitors such as ketoconazole, which can increase budesonide levels and the risk of side effects. Your proactive monitoring and education efforts can greatly improve patient outcomes. Patient education. Educating patients is a cornerstone of effective nursing care. Key points to discuss include adherence, proper technique, preventing infections, monitoring symptoms, and long-term risks. Adherence. Stress the importance of taking budesonide exactly as prescribed, whether it's a daily maintenance dose or an as-needed nasal spray. Proper technique. Teach patients how to use their inhalers, nasal sprays, or oral medications correctly to maximize benefits and minimize side effects. Preventing infections. Instruct patients to rinse their mouth after using inhaled budesonide to prevent oral thrush. Monitoring symptoms. Encourage patients to report worsening symptoms, such as increased shortness of breath or persistent abdominal pain. Long-term risks. Discuss potential risks like bone thinning or adrenal suppression with long-term use and emphasize regular follow-up visits. Remember that clear communication empowers patients to take an active role in managing their condition. Budesonide is a versatile and effective corticosteroid for managing respiratory and gastrointestinal conditions. By understanding its indications, mechanism of action, potential adverse reactions, contraindications, and nursing considerations, you can provide safe and effective care to your patients. As always, your role as nurses extends beyond administering medications to educating and advocating for your patients. All right, well, that ends this nursing review. If you found this video useful, leave a like and a comment so we can continue to make more videos like this. Also, if you have any study tips, leave them below. I'd love to hear from you.